Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah. Basically, the brain uses electrical signal inside the brain to control everything, like what we think, what we feel, what we do. So the seizures it happens when a person's brain is overloaded by an abnormal amount of electrical activity. So some describe the seizure as a storm inside the brain. It is a heavy amount of electric current that develops inside the brain and it causes the seizures. So during the seizure, person can may lose the consciousness. He can shake or convulse, or he can become the confused, or even he even can feel the sudden fear or like a panic.
What is epilepsy?
Seizure and epilepsy. So epilepsy is a medical condition that causes the person to have the repeated seizures. Generally, a doctor will diagnose the epilepsy if someone has at least two unprovoked seizures. Unprovoked seizures means it doesn't have any other cause, like a fever can cause or infection can cause, any pathology inside the brain can cause the seizure. That are called as a provoked seizures. One, but when there is no other etiology, it is called as usually unprovoked seizures. Epilepsy can include the many different types of seizures, and while some people can have only one type, while the others may experience the more than one type of seizures.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures. Basically, they depend upon the whether where this unusual activity starts inside the brain and how much of the brain is involved. So, if the seizure is starting in the one part of brain, then it is called as a focal seizures, and if it is involved in the whole of the brain, it is called as a generalized seizures. So, basically, these are the two basic types of seizures, but other types of seizures are also there, like the myoclonic seizures, absence seizures. Myoclonic means they will cause only the just a jerky or the shaky movement, mostly after awaking in the morning, and absence seizure will cause the only the staring like look features. The patient will stare at one thing, and but for a few seconds he will not respond to anything. They are called as absence seizures. There are many other types of seizures also.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always, but about half of the adults with epilepsy. In about half of adults, we may not find any cause, but in other half, the common causes include the brain infection, brain injuries, sometimes the tumor. In elderly patient, the stroke and Alzheimer's disease. These are the common causes of epilepsy. But besides that, the genetics also plays a role. Means there is no other pathology inside the brain, the pathology in the genes. So researchers say that the certain genetic factors might also make someone more likely to develop the epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, symptoms can vary a lot, but common signs of seizures they include the sudden jerky movements of the limbs associated followed that is followed by the loss of consciousness or stary look or the confusion. Even before this convulsive movement, patient may feel like the sudden fear coming out of body or sudden tingling or numbness in the one part of body. These are the common symptoms. Uh, it will be the better idea all of these symptoms go immediately and talk to your doctor.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, unfortunately, epilepsy has been misunderstood for a long time. Historically, people didn't realize that epilepsy is basically it is a brain problem, neurological problems, and myths develops around it. So they can look the frightening, so the people may react with the fear or even the avoidance, which can lead to the stigma.
How does this stigma affect people with epilepsy?
Those who develop the epilepsy, they often face the negative attitudes and discrimination from other people. These attitudes are basically reflected in the reluctance to marry these epilepsy patients or unwillingness to employ them, aversion to being in the vicinity as them, and even the discouragement of the children from praying with the children, those who have got the epilepsy. So the research has shown that the stigma can increase the frequency of seizures because of the stigma, the epilepsy patient they face the stress, and this stress can increase the frequency of seizures in them. That's why the communities need to be supportive and be informed about the epilepsy.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The common ones include the basically the lack of sleep. This is the main factor. Then stress levels, high stress levels, fasting, skipping the meal, eating the certain foods can exaggerate the epilepsy. Or the flashing lights can cause some types of like the myoclonic epilepsy can be exaggerated by the flashing of light. Then a fever can cause the increase in the frequency of seizures, and skipping the medicines. This is also the compliance is very necessary for the epilepsy patients to means to take the medicines daily, and for the woman the hormonal changes during the menses can also trigger the epilepsy. So it is basically important to maintain a seizure diary to look for the possible triggers that can be noted and that can be prevented to decrease the frequency of epilepsy.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, several healthy habits they can reduce the risk of seizures. I always encourage getting the enough of the sleep. Basically, it is very important. Enough sleep is important as a lack of sleep is a major trigger for many of the people. Eating the regular balanced meals and staying the active can also help. The physical activity is generally safe for the people with epilepsy, but those involving the high risk sports or the uh, they should avoid this high risk activities because they can be dangerous to the health or they can cause the injury basically. And yes, the stress is also very important factor. So managing the stress is also essential. That can be done by practicing the relaxation techniques, talking to counselor, or joining the support groups.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, of course. At home, it is wise to clear the things that can cause the falls, like the cords or clutters, and to pad the sharp corners of the tables that can prevent the injuries to the head. And in the kitchen, one can use the non-breakable dish and consider the microwaves instead of using the gas or stoves. Also, practicing the soft carpets can help reducing the injury. Means can reduce the head injury if someone falls during the seizure episode. So these are precautions are these are the simple things, but it can make the big difference.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah. Just we have to remember that with the right treatment, many people with epilepsy can manage their condition well, and they can lead the good life. Being aware of triggers, practicing the healthy habits, and having the support can make a big difference. And remember, you are not alone. There is a community of support out there also.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.